what's the first shift in thinking or action that can start moving people
That there's
forwards?
usually an undiagnosed issue like toxins, inflammation, infections, autoimmune reactions that may be hard for standard medical providers to identify and test for. And so you need some advanced way of discerning what those things are to get to the root of the chronic pain. So it's really getting to someone who can give you those answers, can help you then go, okay, I can finally see progress being achieved here in my symptoms, in my pain.
Mm. And I guess for you to help someone, they physically
Yeah,
need to
they
get to you, right?
under my license, I need to see patients in person for their initial. But afterwards, we can
Yeah.
work remotely. But a lot of the therapies, like cupping, if they can find someone near them, they can do stuff like that.
Yeah.
We're pretty much the custom microcurrent it's very hard to find someone who does that with the scanning. We're pretty much one of the only people out there. I keep getting that feedback from other medical providers. No one else is doing what you're doing. You're the geek medicine guy.
And so for the audience, do you just want to let them know
So we're
whereabouts
the
you are?
LymeResearchCenter.com. We're located in Frederick, Maryland, and we provide in-clinic treatment for patients. Also, after we have the initial, we can work remotely with patients. We can custom program treatments for relieving pain, like microcurrent. We can also train patients on how to use things like hydrogen therapy at their home. That has also, for neurological issues that are caused by inflammation and toxicity, this is something I do personally every day to keep my brain sharp. And also it has anti-cancer properties. So to keep, because supposedly we always have cancer cells in our body that eventually our immune system takes care of until it doesn't do that. And then we start to get these things growing in us that we don't want. And so this is my way of just supporting my immune system and clearing the cancers and making sure, improving my health as I get older and older.
Yeah. What I was trying to remember, I was going to say, it wasn't necessarily a question, but from my kind of investigations over the years, and particularly last kind of 5 or 6 years, for me, there are, I think it's 5 key causes of what we might consider dis-ease. So for me, the first one is nutritional deficiency. The second one is toxicity. Third one is mental stress. The fourth one is emotional trauma. The fifth one, you could say it's a form of toxicity, but I would say non-native EMFs. I think from my understanding where I am right now, and it's open to change because I'm not dogmatic, that's where I see most dis-ease cause is from those 5 factors. If this sparked something for you, there's a much deeper conversation in the full episode. You can watch it here on YouTube or on Spotify or listen on Apple Podcasts. Like, subscribe, and stay connected for more.